I'm Jacob Sommerfeld. I'm the 81st Civil Support Team Survey Team Leader, and I'm 26 years old. It was a few days after Labor Day, beginning of September time period. I knew for a fact that I had been taking a lot of precautions and taking proper measures. I do grocery pickup. I don't go out to eat very often, and I have a very small group of coworkers that I work around. One of the biggest things that stood out in our mind is that I finally decided to go to a wedding for once, and it was a close friend of mine. And just a few days later is when I started seeing signs and symptoms, and I was very concerned that that was the event that really sparked it off. Looking back and realizing other series of events that led into it and or possible contaminations. My wife is also a nurse. There is still plenty of other possible exposures besides just the wedding, the big social event. My wife tested negative on both occasions while I was in my quarantine state. My son ended up testing positive at one point, so he ended up being quarantined as well, and obviously she was too, being watched closely. I work within the North Dakota National Guard, obviously, and I was able to go to the physician's assistant within our office area and have him administer my test. As far as for the rest of my family, we went through the drive-through testing at BISMARCK Event Center. Super easy, it was fast. It was a very good experience for both my son and my wife. My symptoms were fairly mild at first. It was just a headache. I woke up one day with a slight headache. Didn't seem too out of the ordinary until the headache stayed into the afternoon. And later in the night, I got little to no sleep because my headache only got worse. And then the next day, it was to the point where I had what most would consider a migraine. Then that's when I knew that I had something weird, and I called in to get tested, and I started getting fatigue, experienced no loss of taste or smell. It was mostly just the headache and fatigue. My wife and my son never experienced anything out of the ordinary. Both of them will say that they didn't even know they had anything. One of the biggest things for me is that it was something out of the ordinary. Whether it was the common cold, whether it was influenza, or the novel coronavirus. I knew something was out of whack with my body. I knew that this was probably the most likely outcome, and one of my biggest thoughts when I was getting tested was, if it comes back negative, that's an easy answer to say, okay, let's find other alternatives. And right now the resources are way too easy to get out there and get tested, free for anybody to do. And I knew that it was the right choice, because if I didn't get tested and I assumed that it was the common cold, I could be doing a detriment to not only those at risk, but some of those ones who are just close to me. And then that puts other people that are close to them at risk. Prevention, follow the guidelines that they've put out already. They're very accurate, and it only makes sense. I'm not encouraging isolation. What I will encourage is be smart, wear your mask, have that social distancing, distance yourself, and do what you can to sanitize your home, sanitize when you're going out. The thing that we can prevent is the amount of exposure that you have, and those things can be taken care of by washing your hands, wearing your mask. My training within the North Dakota National Guard and throughout the country, understanding biological agents and how there's a huge difference between bacterials, poisons, and viruses, definitely really made me realize the importance of getting tested and finding out and identifying that if I'm positive, I need to get it taken care of and do what the Department of Health's guidelines are, versus if I don't get tested, I am an unknown. I think the hardest part for anybody to understand is how complex viruses are. There is scientists who have dedicated their entire lives studying viruses, and for a common person to pick up and understand the guidance that these people are trying to put out, it's hard. We all want to live our lives. We all want to do what we can to protect those around us. But a virus is a very complex life form. And because it's so complex, it's hard for any scientist, let alone any government agency, to put out fair and justifiable, clear and concise information that is going to be 100% accurate. That's the toughest part about this unknown. And a lot of people are very frustrated with living in the unknown. My best advice to them is be patient. There is people who are trying to save us. There's people out there who are working every day to protect us. I have first-line experience of being part of that group, and I also know that there's still lots of people who are involved with that. Trust in the process, and if you really, truly want to get a well-rounded experience with this, find ways to get involved. It's a fight that we all have to be into together.